your way. You just don't know how much it's going to be. Do you? Do they tell you this is how much the bill's going to be? Nobody tells you that. And that's what they call a surprise medical bill. And you're sitting there saying, man, I have no idea what it's going to be. Here's a number for you. 41% of insured adults have surprise medical bills, and 2/3 of them are worried about being able to afford that surprise medical bill. You've been there. I've been there before. How many people are going through this? Well, where's the profit margins in this? How are people paying for these? Let me give you some more statistics here. 78% of adults have avoided hospital visits, 44% medical care due to the cost. Have you ever? Know you're sick. You know something's wrong with you. You know you don't know what's going on with your chest pains, your back, pain here. You do not want to go because you don't want that bill. You don't know if you can afford it. But many times you have health insurance and you're still not going. So why do we have health insurance? Why are we paying for it if we do have it? Do you know how many people are asking these questions? So let's continue. 30% said they had to choose between paying for medical bills or basic necessities like food or housing, meaning you have a choice to go to the doctor and paying for that bill versus, man, I got to get some food for the kids and paying for my rent. You know which one I'm going to choose? I'll tolerate the pain. I'm going this way. Have you done that before? Maybe you haven't, but your parents may have done this before. And this continues. 137 million people in U.S. reported struggling with medical bills. Let me say the number again to you. 137 million people. Here's another one for you. You ever gone to the hospital and you're like, oh, you got to stay for 3 nights. You're like, no, I'm good. Listen, man, your leg is broken. You got to stay here for, no. I'll go walk on a crutch. Do you want to, no, leave it alone because I know everything is an add-on and a cost. But do you know how much it costs to stay at a hospital? Do you actually know the numbers? You want to learn about it? If you don't want to learn about it, skip this part and go watch something else because I'm going to show you how much these things cost. Here we go. Nationally, U.S. hospitals charge $417 for every $100 of their costs, which means their net cost is $100. They're going to charge you $417. The 100 most expensive U.S. hospitals charge, ready, between $1,129 to $1,808 per $100 of their cost. $1,808 is 1,800% of their cost. And you know what their answer is? Because they can. So you may say, Pat, give it a break. What's been the history with this? Let me show you. It's been in 1999, it was only 200% per $100, but it's gone up every single year, all the way up to the data we have here, it's 417% as of 2018. And you know after COVID, those numbers went even higher. This next chart is also a little bit concerning because, you know, we did a couple videos in the past, one of them being like, you know, you want to be able to have more regional banks. Why? There's more competition, right? You want to have more community banks because it's more competition. And right now, a lot of these signature banks, a lot of these banks that are going out of business and the bigger banks are picking it up. Gradually, we're going from having a lot of different options to having a few different options. And what happens when we have a few different options, they get to dictate the price or whatever they want to do. The same thing's happening with weapons of mass destruction, where you're hearing a lot of these big companies that would make weapons, they make planes, they make tanks. It used to be so many of them, it's now gone down to only a handful of them. So they have the market, they have control, and they're kind of working together to dictate what everybody else has to pay for. Watch this. When you look at this chart from 94 to 2018, in 1994, only 37% of the hospitals in America belonged to a system, meaning a controlled, consolidated, multi-hospital system, 37%. So the other 63% was independently owned by a lot of different people. So the 37% couldn't push their weight around because they had a lot of other people that were competition. Well, today, that 37% is now 67%, which is collectively being done by a few different people. So they dictate whatever the terms are for the price of these hospitals. That's why they can increase the rate of some of these hospitals on what they're charging per $100. Here's what you will look at. Number one would be Capital Health, which is based out of New Jersey, 1,443%. Number two is CarePoint Health, which is in Florida and Jersey, 1,313%. Third one is Regional Medical Center, which is 1,106% out of Florida. Fourth one is American Academic Health System, 1,064% out of Pennsylvania. Then you got Temple University, 1,000% out of Pennsylvania again. Then you got HCA out of Florida. Then you got Tenet Healthcare Corporation out of Texas. Then you got Community Health Systems, which is national. Then you got Universal Health Services, which is national. You got St. Luke's out of Pennsylvania. 3 out of the top 10 was Pennsylvania, and 3 out of the top 10 was Florida. Now you may ask, why Pennsylvania and Florida in the top 10? Because Florida is in the top 5 oldest states in America, population-wise, and Pennsylvania is the top 8 oldest state, population-wise, in America. So they have older people, so they're like, listen, guys, we got a lot of boomers here. Charge it up, mark it up a little bit. We'll make some money here. Because again, they can. Now, some of you may be watching and saying, Pat, if I can't pay the bill, I can't pay the bill. I just don't pay the bill. That's what I do. Well, there's many ways they can get the money from you. One of them being wage garnishment. They can, in many cases, up to 25%, they can just take the money out of your account if they really wanted to. These people can file for it, and that can happen. Now, obviously, some states are more strict than others, but there is another part to this on a hospital being interviewed on why these prices are going higher. What is the regulation? Who's controlling them? And this was done by Dr. Marty Makary, and here's what he came up with in a book he wrote titled The Price We Pay. Researchers from the University of Iowa called 101 U.S. hospitals on prices from the same type of heart bypass operations. Only 53 provided. The price varied from $44,000 to $448,000. So 101 hospitals, 53 gave the rate from $44,000 to $448,000. My dad has had a bypass. What's the difference? One is 44, one is 448. That's 10 times more. Who dictates the terms? Do I just pick and choose and say, yeah, I think you look like a $300,000 type of person. No, I think you're 80. Let's see you for 220. Who determines what these prices are? Is it a secret? Can we know? Can you imagine you go buy a car? You say, I'd like to buy that Mustang. What's the price? Can't tell you until you buy it. What's the price of the car? Nope. You want to buy it? Yes. $78,000. It's really $22,000. Imagine how weird that is. That's how hospitals work. He continues. Hospital officials confessed that they inflate bills each year in order to generate more revenue. Since the insurance companies pay only part of the sticker prices, insurance confessed they demand bigger and bigger discounts in their contracts with hospitals in order to keep up. Both admitted that they pass on higher bills to the public in the form of higher insurance premiums. And last but not least, watch what this lady said at the end, just flat out. A hospital employee whom Dr. Marty Makary confronted on behalf of a patient who received an exorbitant hospital bill provides the answer. The law allows us to charge whatever we want. If we want to charge $1 million, she has to pay for it. Can you imagine that? So it's already crazy enough, but this next stat I share with you, some of you guys are going to say, I don't believe this. You're going to have to go do your own research when I show you this number. Can you tell me what are the biggest industries in America by revenue? By revenue. You ready? The number one industry in America by revenue, and this is numbers from 2023, hospitals in the U.S. is number one. $1.426 billion. Number two is drug and cosmetic and toiletry wholesaling in the U.S., 1.364. Then you got pharmaceutical wholesaling, then health and medical, then commercial banking, then new car dealers, then life insurance and annuities. Hospitals is number one, and no one even talks about it. However, here's the crazy part about hospitals. If I were to ask you how much money do these guys make, man, on 1.426, the margin's got to be massive. Like this Google, Facebook ad, it's got to be massive margins. That's the problem. Their margins are very small, but how? Matter of fact, if you look at the numbers in 2022 and early 2023, you will notice, according to Kaufman Hall Operating Margin Index, year to date by month, they're in the negative. Look at the numbers right there. Negative 2.1, negative 2.4, negative 1.9, negative. Every month has been in the negative. And even if we go prior to COVID, and maybe we go look at 1995 through 2016, it's always been in the single digits. The lowest was 2%, and the highest is roughly 8%. So how is this even possible? You got 400% to 1,800% of margins. Shouldn't you be making more money? I don't even understand how this is possible. Here's why. Because the government is heavily involved. When you look at Medicare and Medicaid in 2020, combined underpayments, not payments, but underpayments were $100 billion, up from $75.8 billion in 2019. And the 2020 underpayments includes a shortfall of $75.6 billion for Medicare and $24.8 billion for Medicaid. And matter of fact, for Medicare, hospitals receive payments of only 84 cents for every dollar spent by hospitals caring for Medicare patients in 2020. Now, this doesn't include increased labor, increased medicine, $18 billion just for illegal immigrants in 2018, according to Forbes. We can add on a bunch of different things, and the numbers keep adding up. So you realize they're not making any of the money as much as I thought they would be making. But who's not doing their part? Is it the health insurance company? Are they taking the money and leaving? Is it the government, taxpayers? Maybe they're expecting us to pay a lot more. Whose fault is it that this is taking place? Remember earlier I talked about Medicare and Medicaid, where a generation is holding everybody else hostage for making sure that they get their Social Security, Medicaid, the baby boomers. A lot of people are going to get upset at this, but I'm not running for office. I'm not trying to get reelected. I'm not a governor. I'm not a congressman. I'm not a senator. I'm not a president. I'm not trying to win your vote. My job is to ask questions and saying, can we afford it? Every year, we keep getting into more and more debt. What's the solution? Not a worry. Keep kicking this debt to the next generation. Let them handle it. Let their grandkids handle it. Let our kids handle it. Who cares about them? Let's take care of our lives right now. They'll figure out a way. They're young. They're going to be old one day. And what are they going to do? Do exactly what you did. And then eventually, this great idea called United States of America, poof, is gone. And hey, another person comes in. We're in debt now. People are leaving to other countries. Oh, it'll never happen to America. Maybe to Rome. Maybe to the Persian Empire. Maybe to Greece. But not in America. Not here. No, we're headed in that direction with these irresponsible decisions that we're making. And by the way, let me continue. Watch this. The National Healthcare Anti-Fraud Association, NHCAA, estimates that the financial losses due to healthcare fraud might be as high as $300 billion each year. This is on top of everything else. But watch this data of how far along we've come since 1960s. National per capita health expenditure in the U.S. from 1960 to today. So if you look at it right there, 1960, it's $146 per person in expenditure to now, it's gone all the way up to $12,591. How long can we afford this, by the way? With an aging population. Matter of fact, in September of 2020, President Donald Trump signed an executive order aimed at ensuring hospital price transparency and limiting surprise billing, requiring that price information he made publicly available. This was obviously a great piece of legislation because it would give people the ability to compare prices and force hospitals to price operations more competitively. It's like saying, hey, what do you charge for this car? $28,000. Galpin Ford sells it for $24,000. Hey guys, the other guy sells it for $24,000. Match them. We'll sell it to you for $24,000. See what happened? But before you couldn't compare it. So Trump says, I think we ought to do this. And guess who says we ought to continue with this? So Biden directed the Department of Health and Human Services to enforce the rule, which what Trump started. It's like, yeah, this is kind of a good idea. We got to do, but watch what happens. Only a year later, research published by nonprofit group Patient Rights Advocate determined that 471 out of 500 hospitals examined were not in compliance with the new rule. And at the same time, the maximum fine from the federal government for failing to post prices is $109,500 per year, even though CMS said in July that they were planning on raising it to $2 million per year for large hospitals. The problem is they sent warning letters to almost 170 hospitals that had yet to post prices, but the agency hadn't imposed any fines. And Catherine Howden, a spokesperson for CMS, said that the agency expects hospitals to comply with these legal requirements and will enforce these rules. If the hospitals don't comply within 90 days, you know what they do? They send you a warning letter. That's it. You get another warning letter. Can you imagine? It's like a love letter on top of a love letter and nothing else happens. And in May of 2023, some data came out. Ways and Means Committee Chairman Jason Smith brought the facts, citing that fewer than 1 in 4 hospitals are estimated to be in compliance with these price transparency rules, and only 4 hospitals out of 6,000 nationwide have been fined for non-compliance. So guess what? Hospitals are like, get out of here. You're not going to do anything. We're giving you money anyways when you're getting reelected. You need our money. You need us to keep charging more money so we can give you more to your campaign, and we'll hire the lobbyists to come and help you out. Don't act like you care. Say it from stage, but you know you're not going to enforce it behind closed doors. It's kind of what's happening. So I got the one last thing I'm going to show you. This one's going to probably upset you the most on how we can afford to do this kind of stuff. So watch this. Here's an article from American Hospital Association. Look what it says. Medicare and Medicaid pay less than cost. The uninsured pay little or nothing, and others must make up the difference. I'm going to read it to you one more time. Medicare and Medicaid pay less than what it costs. So hospitals who are getting money from Medicaid, Medicaid, they're not getting what it costs them. They're getting paid less. The uninsured pay little to nothing. The uninsured, those are like, I can't afford health insurance. The ones that are not being responsible for having insurance so can't afford it. But the people, the responsible ones, are supposed to make up the difference. The working man, you're paying for it, okay? Watch this. Medicare and Medicaid pay less than the cost of caring for program beneficiaries, an annual shortfall of $57.8 billion. Let me continue. This is very important for you to know what's going on here, because you, the working man, remember in a movie, Sonny tells Robert De Niro, the working man is a sucker, right? The working man is a sucker. This is what he was talking about. We're paying for everybody else that's saying, I'm not going to pay for it, right? This is why the working man is so frustrated in America today, who is responsible, hospital, uncompensated care, Both free care and care for which no payment is made up by patients makes up about 6% of the average hospital's cost. Most hospitals receive no government financial support at all to provide this care, though some hospitals owned by local governments, but not all public hospitals, receive tax subsidies from state and local governments to help offset some of the cost of care for poor populations. Overall, these payments represent 10 cents per dollar of cost. Privately insured patients and others often make up the difference. Remember, Medicare, all those guys, they only make up 6% of the cost. The rest is made up by us. So somebody may be watching and say, Pat, this is very annoying. No, I know. I'm also annoyed. I'm paying for it as well. You are too. I'm not only paying for it, I'm also paying for a lot of different people who are having health insurance that I'm paying for. It's the cost. It's the benefit of you're giving CEOs, hey, what benefit do you offer? Here's our health insurance. Here's our health insurance. So I'm involved on both sides. So what's the solution, Pat? To me, it's all accountability, because we have to sit there and have the tough conversation. Are we going to say yes to Medicare, Medicaid, Social Security at all costs, even though everybody else takes the hit and many go through bankruptcy? Is that fair? Even though it hurts all the working men. It's like that man that was talking to Elizabeth Warren. He's like, wait a minute, you're canceling college loan on the people that didn't make payments. I busted my ass with 2-3 jobs to make sure my kids' college education was paid for. I'm paying the price? Me? Why am I paying? I'm not rich. He's saying this to Elizabeth Warren. She doesn't have an answer for him. She's got a smirk on her face because this doesn't make sense. And a lot of people are going through this right now. So it's accountability in the life insurance industry. Watch how the life insurance industry works versus real estate or loans. Say I sell a house to Johnny. I sell him $1 million house. I get him approved with a bank. The bank says, I'll take this loan. I sold $1 million. The guy that's selling the house, he gets his money. The equity he had in the house. Say you own $600,000 loan. We sell it for $1,400,000 minus the commission. That check goes to the owner of the house that sold it to the new owner. But the new owner who got the house, 6 months later says, I don't want to make the payments. I'm okay. I can't afford it. I don't want to make the payments. The other guy that owned the house, he doesn't care. He already got his check. The realtor, I already got my check. I left. I don't care. You go collect the check. I don't need to collect the check. I don't have any accountability here. That guy has no accountability here. The bank is screwed and this man doesn't want to make the rent. How many times does that happen in America? He sits in that house for 6, 12, 18, 24 months. Some states, you can't even kick the guy out. He stayed there. You can't kick me out. Frustrating, right? You know how life insurance works? Here's how life insurance works. I sell the same person $1 million insurance policy. It's $250 a month. I get advance a check, let's just say $2,000, $3,000. The insurance company sends it to me. Advance. They send me the check. 6 months down the line, Johnny stops making the payments. The insurance company calls me and said, hey, we haven't received the last payment for the last 6 weeks. I can't say, what do you want me to do? Go collect it. I already got my money. No. If you don't get Johnny to pay his next premium, you're going to charge back. How much? Potentially the whole $2,000 I give you or 50%. Let me call Johnny. I'm on top of it. I'll drive to the guy's house to get the payment because there's accountability. That's why I love life insurance, because there has to be accountability. You can't get away with it. And I got my money, I'm good. No, you can't do that. As long as we can create a certain system of accountability here, we can't just say, hey, Gen X, Gen Z, millennials, screw you guys. You pay for it. You can afford it. While everybody else, they're just going to account for 6% of it. Dude, no. I'm trying to have my own wife and kids and family and sending for private school and doing this and doing that and paying my tax. Why are you doing this to me? That's kind of what's going on in the health insurance, the hospital, the Medicare, the Medicaid. So as much as we can say, well, hospitals make so much money, they actually don't make a lot of money. Margins are very small like the restaurants. They're just trying to get money from somebody. And who ends up being the person that pays for the hospital? The working man.